Hi there, welcome to our channel. I'm Dr. Alyssa Easley from West Pelvic Wellness, where we take a holistic approach to pelvic floor rehab. On this channel, we are going to be sharing tips, exercises, and strategies to help you feel your best. So don't forget to subscribe and follow along for all of our content, and check us out on all our other social media platforms. I want to teach you one of our favorite ways to practice connecting to your core and your pelvic floor. Remember, the pelvic floor is a group of muscles that lives in the bottom of the pelvis. There are 3 layers of these muscles. These muscles should be very springy and bouncy. They should contract and lift in, and they should also be able to drop and expand and lengthen. These muscles give us support to the pelvic organs. They provide stability to the joints of the pelvis and the spine. They also give us continence control, so they help us with bowel and bladder control and then bowel and bladder emptying. They also are blood and lymph fluid pumps, and then they're involved in sexual function too. So these muscles are really connected to the diaphragm, which is in the bottom of the rib cage. The diaphragm is a big dome-shaped, thin, flat muscle that moves up and down and helps get the lungs to fill with air and then expel air as we breathe. So when we inhale, the diaphragm pulls down and makes room in the chest for the air coming in. That pulling down sends pressure to the pelvic floor to also go down and drop and expand. So inhale, we can practice pelvic floor dropping and relaxing. The opposite happens when you exhale. The diaphragm is pushing the air up out of the lungs. That creates this moment of lift, and your core and your pelvic floor can then also lift to activate and support you. That is our main goal with this exercise, is practicing getting the ribs moving with our breath and coordinating that core and pelvic floor, drop and expand, and then lift and pull in. So for our rib cage movement, I want you to take your hands around your chest. As you inhale, try to fill the area of your hands and open up with that breath in. That's going to create a better expansion in your pelvic floor than if you just expanded your belly or the front part of your chest. So with hands around, inhale, exhale, everything comes back. Wherever you are, pay attention to those pelvic floor muscles in between your sit bones. Can you feel a dropping towards your chair or towards your sit bones as you breathe in, and then a gentle lift as you exhale? To add connection with our deep core with this, as you exhale, you're actually going to think about closing and lifting the pelvic floor in with a little Kegel contraction and a little core activation that's going to feel like a zipper from your pubic bone to your belly button. So as you exhale, squeeze and lift from below in between your sit bones and draw in those lower belly muscles. Think about keeping the lower tummy flat. The cool thing about this exercise is you can do it wherever you are. You could be sitting, you could be standing, you could lay on your side, you could be on hands and knees. Let's go through a couple of those together. When you're sitting, the breathing coordination with the pelvic floor and core looks exactly the same. I want you to think about leaning forward slightly and keeping your chest angled down. I don't want you arching up and extending your back like this. So chest down. If you want the feeling of your hands to give you a little cue, wrap your hands around the back and the sides of your ribs, and then take that deep breath in through the nose. Let your pelvic floor and your bottom expand towards your chair. And then exhale, we're thinking about lifting the pelvic floor, engaging the deep core with that lower belly hug. With this breath exercise, you can practice coordinating all these things and do 5 or 10 repetitions at a time. If you feel like your muscles are able to hold that lift and that lower belly hug, you could try maintaining that for 5 or 10 seconds and repeating that as you're able to kind of build that endurance and build that connection back with the core and the pelvic floor. Another way you can practice this rib cage breathing, if you're not sure where you're feeling your expansion, is placing a stretchy band around the back part of your ribs, underneath the shoulder blades slightly. So you're going to hold the band in your hands in the front, and with your breath in, try to expand that back part of your body like you're opening up your shoulder blades in the middle. You should feel a little stretch in those middle back muscles. Remember, while you're doing this, allow the belly and the pelvic floor to relax and drop.